Hey everyone, it's Sean Gibbons from the Communications Network. Welcome to this Thursday afternoon, at least here on the East Coast. Hoping you're doing well wherever you may be at. As we start welcoming folks into this room, you're here probably for a webinar from the Communications Network focused on structural racism and health, some new research we got from our friends at RWJF. We're going to be to that in just a quick second. But before we do, as we always do, we're going to start by just saying hello to one another. So hold for just a quick minute. If you would, get into the chat and you'll see that little chat bubble down at the bottom. Chances are you're familiar with it after living a Zoom life for a while. You're going to make sure you're talking to everyone, or it might say all panelists and attendees. And in there, you're going to type the name, your name, where you are, and then how you're doing. And I'll model it for everybody. Go ahead and follow me, gang. You should be able to see it in the chat right now. I said, hey, it's Sean. I'm in DC, happy and curious. Hey, Zach, how are you? Let us know how you're doing. Rhea and Raleigh doing all right. Let's see. Kristen, Jean, Tanir, Alan, Catherine, Sydney, William, Rhea, Paula, Allie, Lindsay. Oh my goodness. Okay, going a little too fast for me now, gang. We've got almost 700 folks who are scheduled to be with us today. So as you see names perhaps that are familiar with you, do know you can do this. You can send direct messages, and we'll also be sharing some research prompts and some information for you in the chat. So go ahead and say hello to folks if and as you can. And if you have questions, we're going to take those at the end, and then we'll do office hours as we often do. So we'll share a link for that a little bit later. With that, my colleague in partner in crime, Kareem Alston, if you would, go ahead and take it forward. This is something I think you all know about, but if you were with us in ComNet Atlanta and you were willing or interested in continuing the conversation, we've all moved over to Slack. Since January, the network has been running a Slack channel for everybody who is a member. Maybe I should make mention that you have to be a member to participate, but it's a great place to ask questions, find community, support one another. All right, with that, let's move ahead. Circles. This is another program we started a couple years ago during the pandemic, but it's really taken hold and come to life over the last 18, 24 months. And what it looks like is it's your network within the network. It's a group of folks you can count on as sort of your kitchen cabinet, and we organize them around the issues you may be working on, or the role you may play inside of your communications department, or maybe the identity that you share with others. And so you can see a link there to get involved. That's open only to network members, but of course, if you are a network member, we'd love to have you. With that, let's scroll forward. This is one that's available to everybody, network member or no, and that is our local groups. So we have 16 of them, as you can see on the map there, around the country. This is a great way to build community with folks who are working in comms for good in your backyard. And we have a couple coming up. So real briefly, we'll just let you know, I think our friends in Denver and Seattle, Kareem, if you can go to the next slide, are coming up. Denver is getting together just a little bit later this month, right after we're all done eating Halloween candy on November the 2nd. And then I believe Seattle is also on the 2nd. So if you find yourself out in that part of the country, or you live in that region of the country, all these smiling faces are lovely people, colleagues of yours and neighbors, chances are. And they would love to come visit with you. So more information on comnetwork.org and here in the chat, as you can see. All right, with that, let's go forward, please. One more thing, we just want to make a promise to you so that we can keep it, which is, as y'all probably know, since 2018, 2019, the network has had something called ComNetwork DEI. And this is a whole bunch of tools and resources, case studies about bringing the values of diversity, equity, and inclusion into your daily practice. We did a survey with y'all back earlier this year to find out how things had progressed. We've been doing surveys since 2019, so this is our third go round. We've done it every 2 years. We'll be sharing the results of what we learned and what you told us in just a couple of weeks, and wanted to let you know that is coming your way. All right, with that, let's keep going forward. Also, a little bit of good news. Everybody hopefully now rested and recovered. Those of us who were with us in Atlanta for ComNet 23, some really good news. We shared this also in our newsletter. Really delighted to report we were able to provide meals to folks in need. We were able to make donations of nearly $11,000 to local Atlanta area nonprofits, including places like the King Center and New Disabled South and United Negro College. We also now, as of just a couple of hours ago, have made everything that we did together in Atlanta available online for everyone for free. So please take advantage of that. Help yourself. Feel free to share it out. You'll find keynotes, you'll find transcripts, you'll find audio of all those things. You'll also find notes from all of our learning labs, as well as the amazing, I think we had nearly 70 poster sessions. And so you should be able to find most of those online as well as photos. So chances are you might see a photo of someone you know, or perhaps a picture of yourself. So go ahead and check that out. All right, with that, I think we're at the end. Oh, I got one more thing I got to tell you, which is, and there's a purpose here, gang. I know it's over a year off, but the reality is we had 200 people stuck on what we call the dreaded wait list for Atlanta. So we have early bird registration open now for Kansas City. It's a limited number of tickets. We'll have them available until December 30th, or they run out. So if you're planning to be with us in Kansas City, Missouri, and everybody asks, This is how you do that. Go ahead and get registered now. We'd love to welcome you. All right. With that, I think I now get the honor and pleasure of passing this along to Celinda and Alan, who are going to be leading a conversation based on some really deep research that they've done over a extended period of time. And they're going to tell us what they learned and how it might be useful to you. So with that, Alan and Celinda, take it away. I'll see you on the other side.
Sean, thank you so much for the introduction and for the opportunity to be able to share with everyone with the Communications Network. And it's an honor to be able to do this presentation and partner with Celinda Lake, who is the hardest working person in the DC area. So we're really grateful for the opportunity to be able to share. On the next slide, we'll just show a couple of things that we would like to cover during the conversation. One is our goal or our intention around trying to expand the coalition of those who see the connection between structural racism and health and are motivated to want to do something about it. We'll also talk a bit about what we learned in the research about the power of values. And we'll also mention ways in which we at RWJF are calibrating the way that we are communicating about the intersection of structural racism and health. Next slide, please. So at RWJF, over the past couple of years, we have really been doing a lot of internal thinking and reflection about our work over the past 51 years. And what we see as being the enduring barriers to health and well-being for all communities, for all neighborhoods and all families. And it is increasingly clear through the research that we've supported, through community wisdom and knowledge that has long existed for and folks who have worked in this field for a long period of time, that structural barriers to health and well-being, namely structural racism, is an enduring barrier, an enduring impediment to stop us from being able to live into the future where everyone has a fair and just opportunity for health and well-being. And it isn't just enough to sort of have that recognition. What it led us to is this question of, well, how could we actually engage in thoughtful conversations about an issue which is the most difficult conversation to have in the United States about racism, and in particular, the intersection between racism, structural racism, and health, in pursuit of everyone having a fair and just opportunity for health and well-being. So we started off with this research question, right? This fundamental question of, well, how do we identify, how do we land on something that's consequential and evidence-based that really allows us to be able to engage people who already see the connection between structural racism and health, to be able to motivate them to want to take action, and to be able to thoughtfully engage people who'd be open to the conversation, who may not already see the connection, but would be open to having the discussion. On the next slide, you'll see that in order to help us answer this question, we partnered with a number of experts in a variety of fields, and you can see the names of the partners with whom we work, starting, of course, with Lake Research Partners, Celinda, and other members of the Lake team, in addition to the Metropolitan Group and others, where we ended up assembling a group that included experts in polling left of center audiences, right of center audiences. We had a psychologist, we had a linguist, we had an asset framing expert on our group. So sort of the Avengers, as I like to refer to them, of sort of researchers that really help us to be able to dig into this question thoughtfully, with humility, but also with courage and sort of with a probing mind. And with that, I'll turn it over to Celinda to talk a little bit about what we learned during the process. Celinda?
Thank you, Alan, and thank you so much. It's really a great privilege to be on with this network, and I have long heard of them and admired them so much. I also really want to thank Robert Wood Johnson for putting together the resources and the intellectual force to really start to make some breakthroughs. And this is an ongoing effort. This is not the tablets delivered. So we are eager to have your feedback, your use of this material, and your feedback on that use. And members of the groups, of the different research groups, are on the call as well, or on the Zoom as well, for the office hours. If we look at the next slide, this was a multi-phase mixed method research that took almost a year. And it included starting with a landscape analysis and literature review, then 18 Zoom focus groups across all kinds of backgrounds, all kinds of partisanship. I really want to acknowledge Robert Wood Johnson putting together the resources so that we could have truly representative sampling and looking at populations like African Americans, Latinos, Indigenous people, Asian American Pacific Islanders, and a broad range of age groups, economic status, political background. We then did with our friends at Topos talkback testing, which looked at 1,000 adults and took what we had figured out about the way people are thinking about things and talking about things and responding to language, and doing another kind of qualitative work, which is seeing how they repeat it, how they take a concept and talk about how they're hearing it. We took all of that information and did a nationwide online dial survey of 1,004 registered voters. And then we did talkback testing again, particularly of illustrations and the visual and metaphor representation, and had really great input with Metropolitan Group, trying to develop the metaphors, the narrative, and the visuals. And finally, one of the most exciting things we did, not just cognitive research and explicit testing, but implicit bias testing. And that revealed some really incredible findings, like different subgroups among the Latino population and things that people were reacting to on an implicit bias and subconscious level that they don't even identify on a conscious level. So I think you'll agree, while this is just the beginning of the work, it was an extremely creative, comprehensive work. And again, I want to thank Robert Wood Johnson, not just for the resources, but frankly for the intellectual force that made this possible as well. So the first thing we did in the research is we did audience segmentation and tried to understand those segments in the audience. And we know that everyone is not the same. We know that some people are available to us, some people are not, some people are in the middle, some people are our bass and the choir and ready to take the baton right now. And the strategies and messaging and just state of information language is not going to be the same for all of these groups. We looked at, we are particularly interested in mobilizing the base and persuading the people that were open to the conversation. If we look at the next slide, you'll see that we had 3 groups that emerged in the audience segmentation. These were not decided a priori. These were based on values-oriented questions, and I'll show you those questions in a moment. We had 31% of the people who see the connection today. They're pretty familiar with the vocabulary, particularly African Americans who are in the base, understand structural racism and are very familiar with the vocabulary. And they see the connection between structural racism, health, well-being, strong communities. We had 25% of the people who rejected the connection. And I think when you see these people's attitudes, you'll agree that we wouldn't expect these people to completely agree with us. These are people that are going to be hard to get. These are the other side's base. And we won't make meaningful change if we say things that would only please this group. And then we have what is the most important segment, 44% of the population who were open to the conversation. They had mixed views. Sometimes they had contradictory views. And what I love about talking to communication experts like yourself is, you know, that people often have mutually contradictory views and usually resent having it pointed out to them. So how do we engage in a values-oriented conversation with people who are open to the conversation but holding contradictory views? So how did we took core cleavages on values and divided the population accordingly. And this comes primarily, obviously this quantification comes from the survey data, but was influenced by everything along the way. If we look at the next slide, you'll see the people on the left were the people who agreed with us. They're the 31% of the respondents who are our base. They think government should do more to solve problems. They think minorities face greater obstacles to economic success than white people. And they believe right now, for many in the US, just working hard is not enough to get ahead. The people on the right-hand side are the people that aren't open to the conversation. They held at least one, and usually they held multiple of these views. They had to agree on all of these things. The government does too many things better left to businesses and individuals. That minorities who cannot get ahead in this country are mostly responsible for their own condition. And they believe what's great about the US is that everyone has the opportunity to succeed if they would only work hard. And the people not open to the conversation were people who were solidly in all three of those right-hand views. And you can agree, I think, that these are going to be pretty hard people to get. They have a value schema, values orientation that's pretty different from where we need people to be to move on understanding and taking down structural racism. But there were 44% of the people who held some of these views and not others. They were open to the conversation, but they were everything in between. Some of them might have been sensitive to government and whether government could be successful. Some of them felt like you're responsible for yourself, but hard work isn't enough anymore. And they might have held what we would consider contradictory views, which they felt perfectly comfortable holding simultaneously. These are the people that we want to think about. How do we message to them? How do we develop a schema for them that has them seeing the barriers and seeing the causality that we're seeing? If you look at the next question, you can see again that people who rejected the conversation, which again I mentioned, they had to believe that minorities cannot get ahead, then they're responsible for their own condition. It's all up to you. They're very, very individually oriented. And they also had to hold a view that everyone can succeed and that racism is mostly in the past. They're very, very sensitive to whether you're quote unquote blaming them for things that they had nothing to do with, or you're talking about the past rather than about the future. If we look at the next slide, you can see these attitudes and you can see the three segments. First of all, you see the total population. Then you see the people that are our base. They see the connection, the people that are open to the conversation, and the people that reject the connection. Everybody, when we asked, how willing are you to come together to take action to diminish patterns of structural racism, 65% of Americans said, I'm ready to do that. I'm willing to do that. Now, I'm not sure I have a great deal of intensity about that. And that's fed often by some confusion about what we're talking about, some sense of cynicism, like if I do anything, will it make any difference? But notice by 39 points, 65 to 26, these people said, hey, I'm willing to take this on. The people that see the connection our base, they're very willing. 87% said, let's go. I'm ready to take action. 57% said, I strongly am willing. People that are open to the conversation, they're willing to take action, but they have to understand, what are we talking about? What kind of action are we talking about? What kind of phenomena are we talking about? How can we be successful in that action? People that reject the connection, a solid majority of them said, hey, you know what? I'm not willing to take action to diminish patterns of structural racism. I don't believe in it. So you can see here a real consistency in these segments based on what kind of action they were willing to take. The second thing we looked at is, if we look at the next slide, is a core element. So our premise was, if we're going to deal with structural racism, we have to rewrite current laws and enforce laws to end patterns of structural racism. And that enforcement word was very, very strong, because a lot of people believe the laws are on the books now, but they're not being enforced. And people believe in general that nothing's going to work without enforcement. In fact, we did some very interesting work on transparency versus enforcement. And people said, well, transparency means you get to watch it go to hell. Enforcement means you get to do something about it going to hell. And you can see here, 2/3 again said, I favor rewriting current laws and enforcing laws to end patterns of structural racism. This is a core value for people who see the connection. If you see the connection, you want to do something about it. People that are open to the conversation, and remember, they're open to taking action. They also say, I favor taking action that is rewriting current laws and enforcing laws to end patterns of structural racism. And again, God bless those reject the connection. Many of us have an Uncle Joe in that category who we probably unfriended by now. But they say, no, I'm opposed to rewriting the laws and I don't want to enforce them. So at least they're consistent. But again, they're only 25% of the population. And finally, the key variable that we were looking at, because it wasn't just across the board that Robert Wood Johnson wanted to look at dealing with structural racism. And Alan said it very well in the beginning of this presentation, that this was core to dealing with so many of the phenomena we face in terms of health of people and communities. And so we asked a core statement in that regard. And if you look at the next slide, do you agree or disagree with the following statement? Racism affects the health of people and communities. Notice we said racism, not structural racism, although obviously connected. 73% of Americans said, yeah, I believe that happens. And one of the things that's quite interesting is how accessible people have certain examples, like toxic waste being dumped in certain communities, or maternal and child welfare and health. Thanks to the work that many of you have done and Robert Wood Johnson has done, people are starting to have some of these stories in their heads. People who see the connection, 89% of them said, I agree with that. 89% of Americans don't agree that the 4th of July is a good holiday or that they like cherry pie. So this is an unbelievable rate of saying, yeah, I totally believe this affects health of people and communities. People open to the connection, to the conversation. One of the reasons they're open to the conversation is that they think it affects people and communities. And God bless those people who reject the connection. 57% of them say, well, maybe I agree a little, but only a quarter say I agree a lot. They really are consistent in their views, and it's very unlikely that we're going to get them. But we have 44% of the population that we can go get, and another 31% willing to carry the baton. So on that note, which says this project could be very successful, let's go look at what we found out was from messaging, and I'll turn it over to Alan to talk about the messaging and the values.
Great. Thank you so much, Celinda, for walking us through that. And I should note that what Celinda walked us through in 9 slides is really summarizing hundreds of pages of research and findings and dial testing and all of the methodologies that she laid out before. So there's a lot that is backing up all of the things that we are talking about today. We just didn't think that you all would have a good time if we walked you through more than 280 pages of a PowerPoint presentation. But so based on all of the things that Celinda laid out and the other research that accompanied that, what did we find about approach? And you'll see on the next slide that what the research showed us through all of the testing is that there was an opportunity for us to be able to have a conversation with that 44% of those who are open to the conversation if we led with a shared value, if we led with a shared statement. And through testing that Celinda and other partners did, what we learned was if we started with a shared statement, move to a positive vision, and then describe the obstacles to achieving that positive vision, and then land it on a call to action and a unity statement, that formulation was the most effective in helping us to be able to engage and to move people who were open to the conversation. On the next slide, you'll see a little bit about what we mean more with leading with values. our impulse a lot of times is to lead with a fact or to lead with an example. And that has been the hallmark of a lot of our communications efforts over a long period of time, lead with disparities data. However, what these findings validated was that was not the best way to sort of enter into a conversation with folks because of their mindset. And I'll talk a little bit about this in a couple of other slides. What we learned was, and we tested this extensively, don't lead with facts or statistics. There was low intensity, and we'll talk a little bit about that later on, but people even wanted to litigate the sources of the statistics, the facts, and they wanted to try to change the people in the stories if we led with stories as opposed to leading with values. The other thing in the bottom point that it's important to note it was that while there was high cynicism about the ability to do something, there was still this voracious appetite for a positive vision and for a solution. Communities, all of us are bombarded with news that are reminding us about what is wrong with what is happening all around us. And there was this tremendous appetite, even with a sense of cynicism as to whether or not it could actually happen, but this tremendous craving for, well, what is the positive thing that we're trying to build, as opposed to really digging into what we don't like. On the next slide, we'll talk a little bit more about why were values so important as the entry point to this conversation. Well, one, the research prior to this project that we started, in addition to what was validated in the research in this project, was that people make decisions on their values. They make decisions on their values, and then they fit stories and facts to justify their values and what they believe based on their values. And just in the research itself, we found that people responded far more favorably to values-based messages, more favorably than problem-based messages, right? So if we led with this many children don't have health coverage, or this many children, or this many communities, versus saying all children should have the opportunity to thrive, everyone's children should have the opportunity to thrive, right? It's a values-based message that will get us to the same conversation, but it just starts in a different way. On the next slide, you'll see that throughout the research, a couple of key values surfaced. One was this notion of opportunity, meaning the ability to move, social mobility, the ability to remove barriers for all people, the value of inclusivity for the purposes of research, of this research, that was defined as no matter what you look like or where you come from, this is able to benefit everyone. Unity. People actually had this sort of gravitational pull to the idea of unity, even though that sounds very trite, and even though that sounds very sort of fantasy land. People actually are tired of the divisions that they experience locally and that they see nationally. This idea of justice, ensuring that laws treat everyone equal and as a worthy person, and then ultimately this idea of hope, a positive, affirming vision that we can all rally around. On the next slide, you'll see one of the consistent refrains throughout the research that we heard was this inertia toward class. So when we spoke about race, we had a lot of questions about, well, what about class? Isn't this really about class? And one of the things that I want to mention is there is conventional wisdom as to what communities sort of respond in a particular way. And it's only people who fall into the category of, politically conservative or white rural people. But what we saw was there was a diversity of folks, including in the Black male focus group, where they really saw the structural impacts of racism, but also had this gravitational pull toward, well, isn't it class as well? So in what we did was in the messaging is we nod to that. We say that in many cases it can be based on class, but fundamentally it's based on race, because it was important to be able to make a nod to class because that really resonated with a lot of the audiences. On the next slide, a question that was a constant refrain was, whether and when to actually say the term structural racism. And it was a complex term. It's a complex topic. And as Celinda noted before, just many communities had very competing views on the term and the meanings behind it. For many folks, except for certain populations, they actually were not familiar with the term or what it meant. The analog that I have used for this is the term voter suppression, which it is a term that is frequently invoked, but it is little understood. And the research says that you actually have to be able to define it before you invoke the term. And what we learned here was that it was important for us to be able to identify the barriers, and you'll see this later on, before actually invoking the term. And it was important that to keep the conversation open, leading with values, meeting communities where they are, engaging communities in a way where they are most likely to have the conversation, not the way that we instinctively want to speak about a particular issue. And showing that while this is an intractable issue with a more than 400-year history in this nation, we believe that there is a promise for a more hopeful and affirming view. The next slide just sort of poses this question of, well, what does that mean for RWJF? Like we went through this process, we've learned about this messaging, and what are we doing differently? On the next slide, we sort of give one answer to this question, and that is, in our communications, we want to show rather than name. And again, audiences did not necessarily understand the term structural racism or understand it in the same ways. And we believe, and the research told us, and we are orienting our communications in this direction to really begin with the entry point of values before getting to actually naming it. Next slide, please. What you'll see here is what we believe this is and what it is not, meaning the research findings, the approach, the learnings. We believe that it is an evidence-based approach. We believe that it really will help us to be able to engage into a conversation with people who are open to seeing the connection between structural racism and health, and over time could be engaged to actually want to take action in order to dismantle it. We believe this is actually an art and a science. This is not a message for everyone. We did not necessarily probe into messengers with this phase of the research. This is not a solution to what has been an intractable problem for more than 400 years in this nation, nor is it something to memorize and to recite without understanding the nuances of your audiences. It's important to state that because we are not coming at this saying, aha, to Celinda's point, we're not emerging from the mountaintop with stone tablets saying we've solved it, we got it. This is what the research showed us. This is an approach that we are going to orient our communications around, and we want to explore it. We want to explore it courageously. We want to explore it with humility and thoughtfulness to really see how we can refine the approach over time, because we think that we cannot get to health equity, we cannot get to health and well-being for everyone without confronting and dismantling these barriers. On the next slide, we'll talk a little bit about, well, what were the actual messages that we landed on? And again, I want to emphasize that this is based on dial testing and the implicit bias and explicit bias, all of the ways in which we try to determine how people actually reacted to this on an overt level, but also internally in subconscious ways. I won't read these to you because we'll provide you with a link to our site that will allow you to be able to dig into this a little bit more. I do want to start with just sharing the shared values. The first line is this is version A. We ended up with two versions of the message. They both tested well, and it provided with flexibility in our communications. So the first line is, we all want to live in the United States where everyone has a fair and just opportunity to reach their best health and well-being, no matter their race, ethnicity, or class. we found high resonance with that approach. We found high resonance with leading with that, and more into the shared value section. We build onto that even more with our commonality, with our shared understanding, building from a base of shared values. On the next slide, you see the second version of this, where we just start with, we all have dreams for ourselves and for our families. And what you'll see in the second section here is, we then talk about what the problem is, but we all don't have the same opportunities to make these dreams come true. And we land in the positive vision and problem statement with, our zip code shouldn't dictate our health. Everyone should have the opportunity to live the healthiest life possible in the place they call home. We also went through extensive testing with how to represent this visually. And, we went through a variety of different images. We had a game board, we had a house, we had plumbing and piping. And where we landed through the testing, and the next slide will show that we landed on this concept of dual bridges. The idea that there are two bridges that in theory move toward health and well-being, but they were built very differently. One bridge is really meant to facilitate arriving at health and well-being with conditions that help to facilitate that. And the other bridge was built with barriers that really obstruct the pathway for many communities to be able to live into health and well-being. On the next slide, we'll talk a little bit about how we landed on this idea of a bridge. One, it was simple and easy to understand for the audiences with whom we tested. Two, we were able to convey that there are barriers that are structural, but they're not impossible to overcome. We have an optimistic end zone here. We have an optimistic future end game that it's possible to reach if we address these barriers and these challenges. And the colors that you saw on the different bridges really signify their differences in the two routes. One has green signs signifying going and opportunity, and the other you see a good use of red, which implies obstacles, which implies, again, barriers to be able to live into health and well-being. On the next slide, I want to talk a bit about stories. What we are not saying is that we should supplant storytelling. What we're saying is that, and what we found in the research is that the research validated a particular method of storytelling. When we led with using examples in the focus groups, in the testing, what we saw was people tried to impeach the source of the data if we started with statistics, or if we started with an individual example about a person. What we saw in the testing is that the respondents wanted to either judge and or fix that specific example. They did not see it as a universal issue. They saw it as a problem for that person. And we believe that stories are critically important. We believe examples and statistics are important. We just don't believe that they are the doorstep to be able to enter into this conversation. Values were the most effective way, and then we were able to invoke stories. We were able to invoke statistics. However, we could not lead with them. We did not see the highest level of success in our conversation. So we've said a lot. And on the next slide, I just want to sort of just list 3 bullets of what are the major takeaways from all of this. One, again, if there's anything that you leave from this conversation, is the importance of leading with values. It is not our impulse. That is not how we have talked about health over the past decades. I have shared that my first job in Washington, D.C. 23 years ago was at what was then the Prostate Cancer Coalition, and we led with disparities data, the different incidence and mortality rate of African-American men. That is how we are trained and conditioned to talk about issues of health. We did not see the highest level of success with that approach. Two, repetition is key. And Celinda invoked this idea of intensity. So while there were people, even those who saw the connection and those who were open to the connection, many of them felt strongly. They said they agree very strongly. There were also those who were like, yeah, I agree. And that showed us that there was an opportunity to dial up their intensity, and how we need to do that is repetition. Those audiences need to hear these messages from a variety of places repeatedly over time. This is not one contact persuasion. It is literally entering into a conversation that will play out over time, and that requires lots of repetition, that requires surround sound, essentially, for people to be able to move. And then finally, this is not necessarily easy to deploy. This requires assistance in figuring out, well, how do we frame this for the audiences that we're engaging? How do we use this for a speech? How do we use this for a tweet? How do we use this for videos? And it requires massaging, and we're still learning at RWJF, working with a number of partners, to figure out how best to deploy these messages and this approach for us. So we're learning a lot. And, today we really appreciated the opportunity to be able to just share with you all how our learning is continuing in this regard, how we're orienting our thinking around this. And, what we see is not just an opportunity, but a mandate in order to enter into a conversation, even with the stiff resistance that we're seeing right now in our country about these very conversations. We cannot abdicate our mandate. We cannot absolve ourselves from the importance of saying that we can't get to this future that everyone says that they want without engaging into this conversation. And I'd like to share with you a video that we crafted that's based on all of this research that tried to summarize and convey what we have spent the last 42 minutes sort of sharing with you. So on the next slide, Kareem, if you could start the video, this is sort of where we landed and how to be able to share this approach.
We all want to live in a United States where everyone has a fair and just opportunity to reach their best health and well-being. But right now, that's not everyone's reality. It's like having two bridges that are built differently, on purpose. One bridge is built to get people safely where they need to go, toward health and well-being. People get quality health care from doctors who respect them. Public budgets fund schools and parks. Anti-air pollution laws reduce asthma. The other bridge is built with barriers that make for a very different health journey. Industries put toxic dumps in neighborhoods. Businesses make it easier to find liquor than healthy food. Public officials ignore lead in drinking water. These barriers are more likely to be built in some communities of color and indigenous communities, and in places where people earn less money. This isn't an accident. Our laws and social practices place more value on some lives than others. Sometimes this is based on class. More often, it's based on race. And that's structural racism. It affects the health of people and communities, which creates unequal opportunity and threatens our freedom and prosperity. Our health shouldn't be dictated by what we look like, who we are, or what zip code we live in. Each of us should have the opportunity to live the healthiest life possible in the place we call home. Since people created the laws and social practices that shape these places, people can reinvent them. We know it works to rewrite and enforce laws that create opportunity. We all can work together so that everyone's children and grandchildren can have the best possible future. We can build stable bridges, free of barriers, to give everyone what they need on the journey to health and well-being.
And with that, we're happy to take your questions. Thank you for your time.
Hey everybody, I'm back. I'm going to go into the Q&A box that you should see. We've already got 6 questions. You can vote for questions by going in there. See if one there's like that you like the answer to. Go ahead and vote for it. That's how I'm going to choose which questions to ask. We'll do this for about 15 minutes or so, then we'll move into office hours. So if your question doesn't get answered, make some time for us. So Linda and Alan have kindly agreed to take 30 minutes. Before I give a question, I want to give a quick shout out to our friend Kenya. She has been doing our ASL services throughout the hour. She's a longtime friend of ours and just want to acknowledge and appreciate her. So join me in that if you will. First question, Alan or Celinda. James asks, how well do you think patriotic messaging works? Like, America is founded on opportunity and freedom, and some people today unfairly can't access that, because. So the thrust of this message is patriotism the value we need to appeal to, or is it part of the equation?
I can share, Alan, if you want a little research that we've done on patriotism. Patriotism isn't that great a value for a couple of reasons. First of all, for some groups, patriotism is not a very appealing value. It's not a portion of our base doesn't like it and thinks of it as invoking nationalism. Native Americans and indigenous people don't like it for obvious reasons. What some people call patriotic, they would call the oppressor. African Americans say that America was never our America. Some Latinos don't like reference to American because of the anti-immigrant feelings. So you've got and then a lot of young people think that American a superiority, American identity is ringing kind of hollow, kind of like democracy's ringing kind of hollow. What is a subset of patriotic values, which is not American superiority or love of America, those kinds of things, is love of children. And you'll notice, as Alan went through, referring to a better future for all of our children is very, very powerful to people, particularly since they think that was something that was part of the American vision, and it's really disappearing pretty fast. You can't ensure your kids or any of our kids are going to get even the same dreams and futures we had, much less better. Community, people feel much more attachment to the community than the country. And so patriotism, there may be a version of patriotism that we should think about, but it tends to invoke backlash among some of our base. It tends to be unappealing to a big segment of the people we want to connect with. And it tends to invoke, it has associated with it for some people, a schema that we don't really like, including nationalism and white nationalism.
Next question comes from Lauren. A bunch of folks wanted to hear the answer to this. How do you counteract the strong bias we have in this country towards the individual or individual responsibility, that idea that we alone can make it?
I'll start. I mean, Celinda is the keeper of all knowledge on these things. I will say that the individualism mindset, it reared its head up in all places. I talked a little bit about the Black male focus group. They were all in on the idea of racist, sort of racism and a racist system. And they were like, yeah, but people need to make better choices. Sort of this idea of the individual, it is, I mentioned sort of before the gravitational pull on that. It is really difficult. And that's actually what we were trying to attend to in part with this research, of trying to break out of this concept of, one of the things in one of the focus groups that we asked the moderator to sort of think about and to sort of message is, let's just stipulate that people make good choices and bad choices, and whatever good choices and bad choices are the consequences the same for people of color in other places as they are for other people, right? And people overwhelmingly are like, no, the consequences are the same. And it's like, okay, well, then that's not about the individual. That is about the system. So just And the one thing I think is important is do not take it for granted with any audience that you're engaging on this, that they automatically see the systemic approach on this, right? There are many folks of a variety of communities that instinctively see it as individualism. I'll turn it over to Celinda.
I think, Alan, you said it very well. I mean, individualism, and I would also couple that with personal responsibility, is a very, very strong norm. We do tap into that, though, because people feel the system and the structure of the system imposes barriers on the individual. And remember, to be in our base, you had to agree that hard work, it isn't always hard work. It's not just good enough to have hard work. So people feel right now that, we're embedding the individual in a system, if you will. We're not denying individuality. We're not denying personal responsibility, but we're saying that the structures and the system and the barriers are getting in the way of the communities and the individuals in those communities, and that is profoundly needs to change. We need to remove those barriers. We need to rewrite the laws. We need to make sure. So we're kind of embedding the individual in the system, and we're saying right now the individual is often being barred from things, being submitted to things, exposed to things that are problematic because of structural racism, because of the systems that we're in. The other thing I would say is that people really, there are some concepts that are getting increasingly contested. Like there would have been a time, 4 or 5 years ago where we would have been saying, use the word fairness, for example. Fairness is a very contested value right now. People think affirmative action is unfair. People think that some of the ways in which we deal with racism are unfair to other groups. So it's a very contested value. So this is America after all. This isn't socialism, no matter what the right wing wants to say. And it is important for us to maintain a real respect for the individual and personal responsibility and hard work. Sometimes we're heard as denying all of that. But there are things right now that are getting in the way that just absolutely infuriate people because of their value for individualism and personal responsibility.
The next question comes from Maria, and she asks, did you find it difficult to get everyone internally to shift to this kind of comms? And if so, can you share whatever strategies you might have used for building this shift? Alan, I think this maybe starts with you.
Yeah, I think, I wouldn't necessarily say that. I mean, it is a challenge and an opportunity, because I think the impulse in health is to talk about health in a particular way, and it has been that way for a long time. And I also want to mention something that somebody sort of invoked offline, where it's like, well, this isn't novel, duh, we've known this for 30 years. And sure, but I think that we don't do it. If it is knowledge that has been well known for that long period of time, it is not our impulse to sort of lead with values. I think that, what we are trying to do within RWJF, one is the idea of leading with values, but also the positive vision, because it can be instinctive to paint the bleakest picture possible about what is happening in the world, because we believe that tapping into that emotion is what will get people to move. And it is in some cases a shift to say, but we have got to land on a positive vision. We have got to show that there is a better way. Otherwise, why try? All of us on this call are sort of communicators adjacent who are trying to do good. All of us in our core believe that there are things that can be changed in the world, and that we and others can play a part in making that change. If we didn't believe that things could be better, we would not be doing what we do. And it is important for us to be able to convey that sense of hope and optimism. It is a change for us internally, and we continue to work on that and try to model it and to learn from it as we continue to deploy it.
James has a question. I'd be interested in how often you think about message pollution happen. How often you think message pollution happens? For instance, for people who've been exposed to a more aggressive rhetoric, the phrase "this isn't an accident" or "on purpose" may imply blame to the audience member. Try that again. Do you guys think there's the opportunity for message?
I'm not sure what the term, and Alan, maybe you're more familiar with it. I'm not sure what the term message pollution means, honestly. But I will say this, our intent, and maybe I've misunderstood the question, our intent is to say, this isn't random, it's not accidental, it's happening deliberately. It's been created by people, so it can be uncreated by people. So we are suggesting that this is happening, and precisely because of the way that it's happening. It's not like the tides. It's happening, and it's been constructed this way, and we have the ability to construct something different.
Okay, next question comes from Shakira, and she asks, will the research findings be shared following the webinar? Mm-hmm. How can folks access these things if they want to go through those 200 and some pages?
So there is a link that we have to sort of the landing page for the message guide that we developed that actually provides much more information. I will put my email in the chat for anyone who is interested in. Oh, great. Thank you for linking to the message guide. If there are questions that you have beyond that, I'll put my email in the chat. Please reach out to me.